Hello everyone, myself Dr. Shombo Banerjee, your surgery educator. Today we are here for MCQ based discussion. Okay, our first question is which of the following statement about keloid is true? So the option A is it contains growth factor. Option B, extended excision is a treatment of choice. Option C, it doesn't extend beyond the wound margin. And the option D, none of the above. Okay. So let's see few things regarding the keloid or try to understand. Okay. So look what happened with the keloid is that it is basically a pathological scarring. So as a result of this pathological scarring, there is a excessive deposition of the collagen, but that too in a haphazard manner, right? And with that, it typically shows or it typically extend beyond the wound margin. That is basically much more specific with the keloid. So regarding the it, first of all, what I would like to uh, explain is that the ethnic predilection. So it is much more predominant in case of African, Asian or Hispanic population, right? But one thing that you need to understand, there is a few cases that has also been reported with a genetic predilection. Okay, so this genetic predisposition has been seen to be carried out with a autosomal dominant manner, but the penetrance of the disease seems to be incomplete, right? Incomplete. So it is an autosomal dominant with incomplete penetrance. Now the key molecule, look, regarding the key molecule, the TGF-β basically plays an important role, and it even plays a central role for the development of the keloid. Why? Because this TGF-β eventually leads to excessive stimulation of the fibroblast, and that itself going to produce excessive collagen matrix, and that is itself going to get deposited in the wound margin and leads to the formation of the keloid, right? Now you need to understand the clinical features, right? So regarding the clinical features, there is a delayed onset, means when there is episodes of the trauma and the development of the keloid, there is around several months to years of the period has been there, right? So it basically takes some times to develop. Okay, so the delayed onset is there, and apart from that, the lesion basically grows beyond the wound margin, which is a very much typical of keloid, right? And obviously, apart from that, keloid basically shows an itching. Also, sometimes the patient may complains about the pain, and there is a hyperpigmentation as well. One thing regarding the keloid is that they usually do not regress on its own, which is supposed to be seen with a hypertrophic scar. So the hypertrophic scar is basically resolves on its own sometimes, but the keloid is not, right? So now let's see the histopathology. So look what happened. So you can see in this image that there is a normal skin is there, right? There is a keloid scar and there is a hypertrophic scar. So regarding the hypertrophic scar, the deposition of the collagen that has been there, that is much more thicker. You can able to appreciate that, right? So the deposition of the collagen that has been there, that is much more thicker than that of the keloid, and they are basically much more disorganized in case of hypertrophic scar. But what happens in case of this two, that the collagen bundles, they basically appears haphazardly arranged in a dense and irregular fashion. So these two words, number one is a dense one and number two is the irregular fashion. So there is arrangement of the collagen, that is two dense and irregular fashion. These two are the important key point. Okay, and obviously your as I have mentioned, TGF-β expression is again associated with it, particularly TGF-β 1 and 2, which again promotes the fibroblastic proliferation, right? So in this image you can see that this is your keloid scar. You can see that they basically extend beyond the wound margin. Mostly they are basically persistent in nature, but the hypertrophic scar remains within the wound boundary. You can see that, right? So this is your hypertrophic scar, okay, and that may regress with time. So regarding the treatment, we generally don't like to go for the surgical excision because the recurrence is the problem. So there is no point of the surgical excision. Then for the treatment, we have multimodal therapy. So in this multimodal therapy, there is your intralesional steroid. Also, there is a silicone gel sheets that can be used for the treatment as well. But apart from that, there is a cryotherapy and the pulse dye laser. Pulse dye laser, these are also being used. Now, one thing that you need to understand, the pressure therapy. Look, regarding the resistant cases, you can obviously go for the pressure therapy. That is the number one, and the number two is the radiation therapy, typically used for the resistant cases. Okay, hopefully you guys are able to understand regarding the keloid. Now let's see the questions again. Okay, so which of the following statement regarding the keloid is true? So they're basically asking about the true statement regarding the keloid, right? So your option A, it basically contains growth factor. No, it basically contains what? Extracellular matrix. So there is excessive deposition of the collagen, right? So this is going to be a true or false. It is your false statement, right? Okay. Extended excision is the treatment of choice. Is it? No, we generally do not want to go for that excision because of the recurrence, right? So it is again going to be your false statement. Then comes, it does not extend beyond the wound. No, this is typically seen for the hypertrophic scar, where in case of keloid, they basically extend beyond the excision wound margin, right? So this is not going to be the case. So this is again the false statement. So here the all the options are basically false. So your answer would be this one, right? This one.